Hello, my name is Nils Andreasen. I'm the Executive Director of the Alaska Municipal League, and wanted to share with you today the testimony that we provided to the House Health and Social Service Committee in regards to HB 76, or the extension of the disaster declaration. Thank you, co-chairs, for this invitation, and to the committee for its consideration of HB 76, extending the state's emergency declaration. For the record, my name is Nils Andreasen, Executive Director of the Alaska Municipal League. AML's membership is comprised of Alaska's cities and boroughs. Just to be clear, too, for the record, in considering the extension of the state's emergency declaration, we are 3 weeks past its expiration. That's important because it is reflective of the overall process that local governments have experienced. Over the course of the last year, the experience that local governments have had can best be described as frustrating. For every state action or inaction, 165 local councils or assemblies have wrestled with what to do in response or in place of. That's required thousands of local elected officials and more than 100 administrators to become public health experts, incident commanders, and targets. Together, they have dealt with hundreds of state and federal actions that have provided guidance without clarity, direction without data, and an emergency declaration that hasn't been firmly in place since November. That means since October, and every 30 days thereafter, our members and AML itself have reached out to the governor and to legislators to renew the declaration to ensure that Alaska's communities have the resources they need to respond to this pandemic. Alaska's local governments have managed through this process, and since the expiration of the state's declaration, continue to do so. This means they've diverted a large amount of their attention to disaster response and management, to responding to the needs of their residents and businesses, and to fill the gap where the state wasn't acting at the local level. And the governor has been clear throughout, placing an emphasis on local control of COVID mitigation. This has come up most prominently with respect to business closures or limitations, or requirements for face coverings. So let's be clear, those had nothing to do with the state's emergency declaration, and everything to do with the transfer of responsibility to the local level, make decisions that helped contribute to flattening the curve and protecting our healthcare capacity. In a lot of ways, local leaders have borne the brunt of the public backlash of these mitigation measures, but it's also true that the public may conflate the disaster declaration with those actions. The loss of the declaration means that local governments have been scrambling to fill holes created in its absence. Many declarations were tied to the states and have either been renewed or are now expired. Many have had to reconsider their own travel, quarantine, and testing restrictions. Many are in the midst of operating testing or vaccination clinics with questions about available resources, training, and authorities. Some are now racing to address spikes in cases. Many are looking at an uncertain future with new strains or variants, supporting vulnerable residents, preparing for an economic rebound, and preparing for the lack thereof. Ultimately, it's this uncertainty that ends up most challenging. A state government that is responsive and capable, at the very least, assists local governments in stabilizing their current operating environment. In fact, the emergency declaration just makes government work better when it's needed most. That means that while we, state and local officials charged with public welfare, continue to try and respond to the public health needs of our communities and to take necessary action that support economic recovery, a declaration remains just a tool at our disposal. The Alaska Disaster Act, which within HB 76 is really just sections 2 and 3, allows the state to allocate, distribute, and manage scarce resources, including vaccine and testing supplies, much of this in cooperation with and at the request of local governments, suspend regulations that may prevent or impede the provision of health services or COVID response, including many that businesses and organizations have depended on to ensure continued operations. Allow DMVA and DHSS to work together within the unified command structure, which is met weekly and bi-weekly with our members. Coordinate with FEMA on non-congregate shelters, which is also intersected with municipal assets. There's a reason that the Alaska Disaster Act is in place, to allow the state to quickly and efficiently act in response to a disaster. Any delay to this simply erodes the partnership that is in place between the state and local governments, between the state and its healthcare providers, and ultimately between the state and the business community. If we want to be open for business, Local governments need a state whose emergency powers are fully employed on behalf of exactly that. Anything less places extreme pressure on local officials, slows Alaska's economic rebound, and places Alaskans' lives at risk. Committee members, what is perhaps most disheartening is that I know my testimony today may not result in the desired or quick outcome that I've joined colleagues from all sectors in advocating for. At this point, it's not COVID fatigue that I struggle with, but it's having this conversation about whether there is to be or not a disaster declaration in place when we continue to need just that.